Welcome back to Fertile Ground, where fertility specialist, obstetrician and gynecologist Dr. Jyotika Ruba talks us through the big questions and latest research surrounding fertility and pregnancy. Today we're talking about freezing eggs versus freezing embryos and why you might choose one option over the other. Dr. Jyoti, welcome back to another episode.
Thanks very much for all this information you're giving us.
Oh, you're very welcome.
I've heard that you're getting a few people in that are mentioning they've listened to the podcast.
Yes, it's fantastic. It's very exciting.
And are they asking lots of questions? And
I think that they come in feeling a lot more prepared for their appointment.
Awesome.
Which is great.
Well, today I wanted to talk to you a little bit about people that have gone through an IVF treatment and they've gone through the process of collecting these very precious eggs, and then the decision sort of needs to be made whether you're going to freeze your eggs or you're going to turn them into embryos. What does that look like, and what are the things that we should understand when making that decision?
I think a lot of women who come in with just the view of freezing their eggs often don't have a partner at the time and would not really be interested in getting donor sperm and then creating embryos, because they envision having a partner in the future and that their partner would be part of the DNA of their child. So I think that the decision to freeze eggs versus freezing embryos has a lot to do with whether or not that person is partnered up and ready to have a baby, versus single women who are looking to perhaps try and preserve their fertility. And I think a lot of women are not willing to create embryos with the uncertainty of not knowing whether they'll have a relationship with someone in the future.
So freezing embryos with, for example, donor sperm.
Yes.
Locks it in, whereas if you freeze eggs, you do have the option in the future.
Exactly.
And is it a viable option in the future?
So I think, again, that really depends on age. So the younger you are when you freeze your eggs, the more likely they are to successfully thaw. But there is unfortunately an attrition rate with freezing eggs because they're a single cell. Even with the advanced techniques of freezing these days compared to 10 years ago, we're able to have more eggs survive the thawing process, but only about 80% of those eggs will actually survive the thawing process. And then the means by which those eggs are fertilised is slightly different as well, because the actual freezing process hardens the outside of the egg. Then the future of fertilising those eggs would only be with ICSI, so that is actually selecting a sperm and then pushing it inside the egg to cause fertilisation to occur. So that does incur a little bit more cost, and it can be a little more complicated in terms of process. So I think in terms of freezing eggs, if a woman is single and not really ready to have a pregnancy yet, not looking at donor sperm, then that person's best option may be for them to freeze eggs. The younger you are, the fewer eggs you'd probably need to collect to give you a good chance of a live birth in the future. The problem is it's absolutely no guarantee if you freeze your eggs that from that batch of eggs you'd actually be able to have a baby in the future. So it depends on your age as to how many eggs you'd need to freeze. And that would also mean for some women going through the IVF process and collecting eggs not once but perhaps multiple times. And that can be an expensive, prolonged and stressful process.
Yeah, and in one of our other podcasts we talked about the time it takes for that to happen. When you freeze eggs, do they last forever?
That's a really good question. So I think the data shows that for at least 10 years, you should be able to freeze your eggs and thaw them. Beyond that, there isn't very good data, because freezing of eggs and what we call vitrification of the eggs has only really been around for about that long. So we really only have data for that. So I think that needs to be looked at again if women are looking at keeping them for longer. And there's there are a lot of different reasons why women might choose to freeze their eggs, and one of them sadly can be cancer treatment. So some ladies look at preserving their fertility, but they may only have a short window for that opportunity to come up, and the government does help fund those women who may be facing treatment for cancer and helping them to preserve their fertility.
Yeah, that's great to know. I wasn't aware of that. And then, so what about the option of freezing embryos? A sperm obviously has to be involved in some capacity. What about the lifespan of an embryo?
So I always discuss, if women do come in and talk to me about freezing their eggs, I always discuss the alternative of freezing embryos, whether that's with partner sperm or with donor sperm. And the reason is embryos, because there are many cells in an embryo, when we freeze it, they have very good chances of thawing, surviving, and giving a woman an ongoing life birth. So it is much better in terms of outcome, in terms of pregnancies, in terms of babies, to actually freeze embryos rather than to freeze eggs, if that's an alternative for that woman.
Yeah, that's an interesting way of putting it, right? The outcome is more successful.
Yes.
So how do you have that conversation?
I think it's a really difficult conversation because, as we touched on before, there are so many elements in a woman's life or in that couple's life that may that influence which decision they make. And I think you can only make the best decision with the information you have and the situation you find yourself in at that particular moment in time. It's very, very hard to plan for a future if you don't know exactly what's going to happen in the future. And I think that's where women find a lot of difficulty making that decision, can be quite torn between the long and sometimes drawn out process of trying to find donor sperm, whether that's anonymous donor sperm or perhaps involve someone they know to in order to get the sperm that they need. That's a difficult process. There can be legalities, there can be other testing that's needed, there's counselling. So it's a I guess a very daunting process for some women, and I think they find it easier to perhaps wrap their head around just doing a cycle themselves and freezing eggs and giving them some hope of having a baby in the future.
So you mentioned that someone might have to come in several times. What sort of time frame are we talking about? What sort of costs are we talking about to go through all of this?
So if you are planning an egg freezing cycle, then it's usually the same length of time as any IVF cycle, obviously without the embryo transfer part of it. So usually we're talking about 2 up to 3 weeks of medication, and then the egg pickup process, which is an anaesthetic and a procedure. And through that process, there's medications that cost money, and the IVF cycle itself is costly. And if it's done electively, then again, it's a lot of upfront cost for that person. And again, if that's several cycles, that may be several months of treatment that they require before we have an adequate number of eggs that may give them, a reasonable chance for pregnancy in the future.
Yeah, I know it's a complicated question, but when you say an adequate number of eggs, can you put a number on that?
So it really is age dependent, because the age of the egg is integral to whether or not that egg will fertilise and successfully give you a baby. The younger you are, the less eggs you'd have to freeze. And there are estimates that we can go through and complex graphs that we can look at that help us to try and understand how many eggs we might need to freeze to give you, say, a 60% chance of having a baby in the future, a 70% chance. But it's certainly still no guarantee.
But having eggs from a younger woman is the big benefit there.
Absolutely. So it's the age at which the egg was frozen that matters the most. So the younger the egg, the better it would fertilise.
So to achieve those numbers of eggs can be a timely and costly process. How do you prepare people for that? What do people need to know?
I guess that they need to know those things before they embark on the process so that they're not falsely reassured by getting, maybe 5 eggs or 6 eggs and thinking that's going to guarantee them having a baby in the future. And I suppose some eggs are better than no eggs, obviously. But I think that they should be aware that, the more eggs the better. If they have the resources, then to spend them in a wise way and perhaps do 1 or 2 or 3 cycles and collect as many eggs as possible. But I guess it does depend on their resources and their ability to continue functioning through a lot of things like work. Most of us have to go to work and still have to do that, and to hopefully be supported while they do that cycle by, the people around them. That's really important because it can be a bit of an emotional roller coaster and difficult for that person if they're going through that experience on their own.
Beautiful. Thanks very much, Jodie. I think that's really valuable information for people.
No problem.